During the investigation of a patient with symptoms from the lower urinary tract, it is important to consider and evaluate the residual urine, the emptying function of the bladder. Dysfunction of the bladder and the lower urinary tract usually means that the residual urine rises. It could be problematic because this could really cause a lot of complications, as we also have mentioned a little bit earlier during this section of the course. The most common way to evaluate if there's a large bladder in the abdomen is to use your hands by palpation of the abdomen. We palpate where the bladder is located, and if we feel a large resistance, it could be the bladder, indicating an inability to empty the bladder. However, it's kind of unreliable when it comes to smaller volume inside the bladder. So the absolute best way is to use a catheter. A catheter can be placed through the urethra into the bladder, and then we will get an exact measure on the volume of urine after voiding inside the bladder. However, that method is a little bit invasive, and we have to prepare the patient, and there's also risks by doing that, by putting in things into people's bodies. So we have other methods. We can, for example, use an ultrasound machine. This machine is called a bladder scan. It's a machine that measures the volume of the bladder. It has a microphone. We put some gel on the microphone in order to get the best contact with the body. We put the microphone above the bladder, and we measure with our machine. And after a few seconds, we get a very good measure on the residual volume. So what can happen if we have a large residual? Well, lots of complications and risks: stones, infections, kidney function, quality of life, and so on. So that's very important to consider residual in a patient with LUTS. Problems usually starts to increase after about 200 to 300 milliliters of urine.